Hello, everyone. Welcome to another episode of Together San Diego. I'm Luis Cruz, Community Relations Director for the San Diego Union-Tribune. Today is World Tuberculosis Day, and joining me this afternoon to talk about the local efforts to fight this deadly disease is Gutierrez, CareTV Coordinator at Champions for Health, Kim Heinle, Interim Executive Director at Bayside Community Center in Linda Vista, Tram Intern at Bayside Community Center, and Dr. Ankita Kadakia, Chief and Medical Director at San Diego County Public Health Services, Tuberculosis Control and Refugee Health Branch. Thank you all for joining me this afternoon.
Thank you for having us.
Thank you for having us.
Thank you so much.
My pleasure. Dr. Kadakia, let's start with you. Today is World TB Day. Could you tell us more about this day?
Yes, I'd be happy to. First of all, thank you so much for having us on your program on this very important day. World TB Day is held annually on March 24th, which is the day in 1882 that Dr. Robert Koch discovered the bacteria that causes tuberculosis. This is Mycobacterium tuberculosis. We use this day to raise public awareness about the devastating health, social, and economic consequences of tuberculosis and the step-up efforts to end the global TB epidemic. We also use this day to honor the tuberculosis survivors and their families that experience this challenging disease. And of course, we want to recognize the hardworking people that dedicate their careers to tuberculosis disease. The theme for this year's World TB Day is "The Clock is Ticking." This theme signifies a call to action to increase our efforts in eliminating TB worldwide. There are events scheduled locally with the lighting of our county administration building downtown in red, and several World TB lectures statewide and nationally, which you can find on the CDC's World TB Day website.
And talk a little bit about, give us a brief overview about tuberculosis. How serious is this disease?
Unfortunately, tuberculosis is a very serious disease with the 10% mortality rate. And when we talk about mortality, that means people who are dying from tuberculosis. It is the 13th most deadly disease in the world, according to the WHO. And so we do see a significant impact in communities, especially those of immigrant backgrounds and Asian backgrounds as well. Here in San Diego, we have seen consistent rates of TB, and we're actually considered a high burden county, meaning we do see a significant amount of tuberculosis compared with other counties across California. It's an airborne disease. That means it's transmitted in the air simply by breathing it in from someone who's infected with tuberculosis. But the good news is that we can treat it, and we usually use 4 drugs to treat tuberculosis, and we can also prevent someone from going on to develop tuberculosis if they were exposed by simply giving them some medication to make that tuberculosis basically become dormant or go to sleep in the body.
May, tell us about Champions for Health and CareTV. And go ahead and unmute yourself. Yes.
Of course. So Champions for Health is a nonprofit organization that was founded in 2004 as the San Diego County Medical Society Foundation. By the leadership of the San Diego County Medical Society. Our vision at Champions for Health is to address the unanswered healthcare needs of the low income and uninsured San Diego County residents. So we work with many community partners and supporters to achieve this vision. And with defined programs, we support and improve the access to care in the community, and we support the physicians and the medical community, and also the physician wellness. And one of these defined programs is CareTV. CareTV stands for Collaboration for Action to Achieve Results and towards the elimination of tuberculosis. We are a private-public partnership consisting of 2 San Diego agencies. One is our agency, Champions for Health, and And the other one is San Diego County TB and Refugee Health Branch. We are also supported by the work of TB Free California. And TB Free California is a partnership among the California Department of Public Health and community clinics throughout the California to eliminate TB. And together as a team, we are committed to reducing the burden of tuberculosis in Vietnamese and Filipino communities in San Diego County. CareTV started in September 2020. TB Elimination Alliance gave us funding. And TB Elimination Alliance is a partnership among the Centers for Disease Control and Prevention, the Asian Pacific Islander American Health Forum, Association of Asian Pacific Community Health Organizations, Hepatitis B Foundation, and Stop TB USA. And as a first step for this program, we are working on community and provider outreach to identify TB prevention messages and develop education materials that are both culturally and linguistically appropriate for our focus population, which are Filipino and Vietnamese.
Yeah. And Dr. Kadakia, could you describe the status of tuberculosis in the Filipino and Vietnamese communities in San Diego County?
Yeah, for San Diego County, the majority of tuberculosis cases, about 71%, occurred in persons who were born outside of the United States. Rates among Asian and Pacific Islanders and Hispanics are more than 10 times that of non-Hispanic whites. The TB rate among persons born outside of the U.S. was nearly 9 times higher than the rate among U.S.-born persons, and it varies by birth country. For Filipino and Vietnamese individuals, they did experience higher rates of new tuberculosis infections for San Diego County for 2017 to 2019.
Okay. And May, can you tell us about what types of outreach activities that CareTV will be doing with Filipino and Vietnamese communities?
Yes, so the core of CareTV is our advisory committee, and the advisory committee consists of Filipino and Vietnamese representatives that are invested in providing the most accurate information about health in regards to their respective communities. The members represent some organizations in the San Diego County, which are Samahan Health, Bayside Community Center, San Diego County TB Control and Refugee Health Branch, and also from San Diego Unified School Nurses. So with the help of this advisory committee, we are conducting surveys in the Vietnamese and Filipino communities to learn more about their knowledge of TB and how they would like to receive their information. And we will be distributing these surveys to healthcare providers also that serve our focus populations, as well as additional community members. And then we gather information from these surveys, and then we will follow up with TB education and focus groups to our partner organizations, such as Bayside Community Center.
All right. Well, all right. Speaking of Bayside Community Centers, Kim and Tram, tell us about the Bayside Community Center and how your organization will be supporting CareTV.
Absolutely. So Bayside Community Center is an 89-year-old nonprofit organization located in the heart of Linda Vista, which is home to one of San Diego's largest Asian and Pacific Islander populations, making up just over 20% of the neighborhood, the majority of which are Vietnamese. So about 35 to 40, sometimes 45% of the clients we work with at Bayside Community Center on any given day are Vietnamese, which is why the work the CareTV team is doing is so important. And at the core of our work here at Bayside is our mission to empower our diverse community to improve its quality of life. And that includes health and wellness. And we want them to be their own best advocates in that. So our intern at Bayside, Tram, who is also a Linda Vista resident and a Mesa College pre-med student, she's going to share a little bit more about the specific work that we're doing here at Bayside in support of tuberculosis prevention and awareness. Tram?
As a CareTV partner agency and an advisory committee member, first, Bayside will be a survey distribution site We will collect survey as part of our weekly on-site food distribution and home deliveries to Linda Vista residents. Second, we will invite our community members to participate in the TB education and focus group activity so they can provide their feedback on the TB prevention messaging. And third, we'll get the community's input on the needs of health education in their neighborhood, like Linda Vista. As an intern, I hope to break down the language barriers that might exist among our Vietnamese clients, helping by providing translation around critical topics like TB prevention, awareness building, and focus group. We have the direct connection and the trust of the community members who are at the foundation of the CareTV's work.
And if you'd like to learn a little bit more about the work that we're doing at Bayside, you can visit our website at www.baysidecc.org.
All right. Thank you very much. Yes, communicating with someone in their native language is very important. So thank you for everything that you're doing. Dr. Kadakia, how does CareTV fit in San Diego County's overall goal of TB elimination?
That's a great question. The county's Tuberculosis Control and Refugee Health Branch is proud to have the support of our County Board of Supervisors and with their approval to create a tuberculosis elimination initiative. This TB elimination initiative is a public-private partnership focused on coordinated countywide TB prevention response. The initiative is co-chaired by Dr. Wilma Wooten, our public health officer and director of San Diego County Public Health Services, and Dr. Jeanette Aldis, who's the director of infectious disease at San Ysidro Health. CareTV is an important program and part of our communication and marketing committee for the TB elimination initiative, and it's one of the initiative's 5 action committees.
Okay, and May, how can people get involved with CareTV? And go ahead and unmute yourself, May.
Yes, so I invite everyone that is interested in becoming a part of CareTV, either a part of our advisory committee or completing community or healthcare provider survey, to contact us at the email on the screen right now, care.tb@championsfh.org. We're certainly looking forward to hearing from some of you. Thank you all so much.
All right. Thank you very much. Dr. Kadakia, for those that are interested in knowing their TB status, what would be their next steps?
Yeah, again, great question. Everyone should know their TB risk factors for tuberculosis. Screening can happen at your doctor's office. We use either a simple TB blood test or a skin test to see if someone has been exposed to TB. There are certain people who should be tested for TB infection because they're at a higher risk for being infected by TB bacteria. And that includes people who've spent time with someone who has TB, people from a country where TB disease is common, and this might be Latin America, the Caribbean, Africa, Asia, or Eastern European or countries, or Russia. And then people who live or work in high-risk settings like correctional facilities, long-term care facilities, or nursing homes, or homeless shelters. Healthcare workers who should be screened, and then infants, children, and adolescents who are exposed to adults who have increased risk for tuberculosis or latent tuberculosis.
Okay. Very important information. Is there anything else anyone here would like to add before we go?
Just do your part to know your risk factors, and please speak with your physician if you want to get more information about being tested for TB. Happy World TB Day.
All right. Well, thank you all for everything that you are doing to raise awareness of this infectious disease and communicating with diverse communities here in San Diego County. Thank you, Dr. Ankita Kadakia, May Gutierrez, Kim Heinle, and Tram for everything that you're doing.
Thank you for having us.
Thank you. Thank you so much.
It's my pleasure. And thank you at home for watching. Have a great day, everybody.
News is more important today than ever before.
I'm currently outside Otay Mesa Detention Center.
I'm about to get a report at Sharp.
Out at Sunset Cliffs.
COVID testing site.
We live for these times when we're able to bring the news into the homes of people who need it the most.
I thank all of you for supporting our work.
When you subscribe to the paper, is
you're telling us that you believe in what we do.